Today I will be showing you how to put a suppository into a patient and how to administer an enema. So first I'll do the suppository. You always want to ensure proper hand hygiene when doing suppositories, of course. First you want to come in, identify your patient. You also always want the head of your bed, you want your bed to be very flat for both suppositories and enemas, so the patient is most comfortable. All patients for these procedures are in left sims. It is most comfortable and easiest with how the stomach works and how your intestines are for them to be in left sims. So we're going to get the bed flat here. For the suppository, you need to make sure you have all your supplies gathered. You need your lubricant, you need your suppository, and you need proper hand, your gloves. We're going to put the side of the bed down here now that it's flat. So you're going to identify your patient, then you're going to put the covers back here and expose the patient. Like I said, we're going to want them in left sims. Alrighty. So that's how your patient will be laying. And once your patient is ready, and after you've explained your procedure, you want to get your suppository ready. And you want to be fairly quick. So first you're going to put lubricant onto a tissue or a paper towel. Then you want to take your suppository, making sure that you don't get your glove into the lubricant. You want to dip the tip of the suppository into the lubricant to ensure that the patient will be as comfortable as possible while administering the suppository. And then you want to put it into the anal sphincter, preferably along the side, not right directly into fecal matter. You want to have the patient take deep breaths so that the anal sphincter is relaxed. Then you will push it all the way up with your index finger, preferably about 4 inches, but it needs to go basically as high as it can and along the sides. And don't force it if it's not an easy entrance, because it can hurt the patient. So once that's in, you will want the patient to keep breathing and hold the buttocks area together so that the body's natural response is to expel it. So that feeling will go away if you hold the buttocks together and have the patient breathe through it. Now you want the patient to keep the suppository in place for at least 20 minutes. And once you ensure they're comfortable, you can put them back to rest. You want to ensure that the patient can keep the suppository in for at least 20 minutes to have the suppository melt, and so that it can go into the fecal matter and help the patient with whatever issue they may be having, whether it be constipation or whatever. So that is how you administer a suppository. Always ensure privacy for the patient for both suppositories and enemas. Explain your procedure. It can be scary to a patient, so you need to explain your procedure and tell them why you're doing it and what exactly you will be doing. So once that's complete, you always want to put gloves, wrap them up in with the suppository, and dispose of it properly, because it does have fecal matter on it. And now for an enema. You want to re-don gloves. For enemas, you need warm water, about 100 to 105 degrees. So the same thing, come in, explain to the patient what you're doing and why. Left sims again, ensure privacy, and expose the anal sphincter. You always want to have a sheet underneath the patient. For the purpose of myself using a mannequin, I'm not actually going to add water to the enema because we don't want to ruin anything, but normally you would have 100 to 105 degree in temperature water. So, once this bag is filled, it depends upon, you need to check over your physician orders and see what kind of enema needs to be administered. If it's enema until clear, you need to keep doing it, but you can't do more than 3 large bags at a time because it can eliminate the patient's electrolytes, and that's very important in the patient's health. So you will need to check with the physician if it's not clear after 3. So once you have put the water in here, you want this little clamp, you want to put it into a bedpan. That's why I have a bedpan here also. You want to release the air out of the enema. This is a pre-lubricated tip, but I also may put some more lubricant on, depending upon if I think it's enough or not. So once I have the water in the bag, I would put some water into the basin so that I know that I don't have any air bubbles in my enema bag. And in a hospital, you could also use, a rolling rack, like an IV rack or something, if you don't have another nurse to help you, because you do kind of need more than 2 hands at some point. So your bag is full. You want to hold the bag 12 to 18 inches above the patient. And now that I know the tip is lubricated very well, I will explain the procedure to the patient and once again have them breathe in and out deeply to relax the anal sphincter. I'm going to go in along the side, and I need to administer my enema at least 4 inches up into the anal sphincter. Once again, holding the bag 12 to 18 inches. Same with enemas as suppositories. You don't want to force it. You can gently twist the tubing to make sure that it is having a safe entrance. You don't want to damage the lining of the anal sphincter. And once this is held here for 12 to 18 inches above, you want to hold it here for at least 5 to 10 minutes. In that time period, if the patient explains that they are having discomfort, you would clamp off your enema right there. And you can also clamp it gently during the entire process to not have such a hard flow of water. And when have the patient breathe through it, and that need to expel the water or whatever you're putting in through the enema will go away after the breathing. Then you can slowly open it back up again. And you want to, from the 12 to 18 inches, you want to go back and forth with that, up and down a little bit and gently. And keep clamping it off as the patient says that they're uncomfortable. After the 5 to 10 minutes, you will remove the enema. You will place it onto a sheet over here that is on your bedside table that already has contaminated on it, and it was ready to take the contaminated enema. You want to, once again, right away, you want to close the anal sphincter, hold the buttocks together so that the need for it will go away. You can keep going until they can't hold anymore or until you need to take it out as far as the bag goes for being empty. And then you will assist the patient to the bedside commode or the toilet, whatever they would use. So I'm going to take away the basin that has water in it. So after that, I would take the patient to the bedside commode or toilet. You want to note the type of enema you used, the date, the time, and the amount expelled. If you think they expelled everything that you put in through the enema, then you can help your patient back into bed and go and do all of your charting. And if it needs to be repeated, you want to make sure you can do it all at one time. You don't want to, do this to a patient and then 10 minutes come back in because you're busy. So if you know it's going to take a while, the enemas can take up to 30 minutes. So if you know it's going to take a while, you may want to make sure you have an allotted time to do that. And of course, between every procedure you do with the patient, you want to don gloves and use hand sanitizer. Thank you.